You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxie Mooney. Welcome back to the show, Health Innovators. On today's episode, I'm sitting down with Jonathan Hunt-Glassman, who is the CEO of OarHealth. Welcome to the show, Jonathan.
Thanks for having me, Roxie.
It's so good to have you here today. So let's start off by just talking about why OarHealth. What drove you to build a business like this? And tell us a little bit what it's about.
So, OarHealth helps people get access to medication that's proven to help them drink less or quit. The reason that I started it is I needed it. I struggled with alcohol misuse my entire adult life. What started as binge drinking in high school and college became a pattern of drinking to blackout in my 20s, and then having multi-day binges and experiencing the symptoms of withdrawal from alcohol. And over those 15 years or so, it was no secret to me that I had a drinking problem. So I sought help in a lot of the places that first come to mind: AA, individual psychotherapy, the emergency department, and pretty much always heard the same thing, which was you need to quit drinking and start going to meetings. And I gave that a shot, but it never really clicked for me. What was much more of a turning point was connecting with a primary care physician who did two things that felt very new to me. One was accept and support my goal of moderation rather than abstinence. And the second was suggest prescription medication that could be a tool to achieve that goal. And those two things at that point in my life were nothing short of transformational. I felt like I was able to get control back over alcohol rather than vice versa. But as I reflected on the experience, it was troubling how long it had taken to find that right fit tool. And it didn't take too much research to learn that I was far from alone in not having access to this safe, effective tool.
So, I'm curious because obviously alcoholism has been around for a really long time. But it seems to be almost like culturally or socially more accepted to talk about it and to talk about alternatives. I mean, there's hardly a restaurant that you go to or even a bar that doesn't have a pretty comprehensive mocktail list. And here in Orlando, they actually even have bars that are just mocktails. So there's something shifting in the world today. Tell us a little bit about those trends.
I think that's dead on. Over the last 10 years, I think we're seeing folks rethink their relationship to alcohol. Do I want to be sober entirely? Do I want to be sober light in some sense, sober curious? The rise of serious adult-oriented beverages that don't contain alcohol makes that easier. Sober spaces like sober bars that we have here in New York as well are a great part of that trend. And many people will be able to attain their preferred ideal relationship with alcohol through those sorts of non-treatment, non-medical, non-pharmaceutical interventions. But then there's a group of us who can't get to that ideal relationship with alcohol just through the innovations of the consumer economy. And that's where things like convenient, accessible, approachable treatment options need to be part of the recipe as well. So I think of what we do at OarHealth as certainly consistent with and hopefully part of the broader cultural trend towards rethinking relationships with alcohol, but geared towards a little different slice of the population.
I love the language that you're using to even describe this. And it sounds like it's really intentional, almost kind of like with mental health, where we've kind of starting to change the language to remove some of the stigma. I can kind of pick up on this intentionality behind the language that you're using to describe this relationship with alcohol. What's
We
going
do
on?
want to get beyond the old-fashioned black and white notion that the world can be divided into alcoholics and people who have no problem with alcohol whatsoever. Reality is a lot more complicated than that. In fact, the term that clinicians use today is not alcoholism, it's alcohol use disorder. And they
Okay.
think of it as a spectrum disorder with severe, moderate, and
Mm,
mild subtypes,
mm,
all of whom, are amenable to treatment with a variety of options. That's another one of the older notions that we're trying to get beyond, that there's only one way to recover.
mm,
The
mhm.
truth is, there are a variety of evidence based options for treatment that can make drinking less or quitting easier. Certainly, mutual peer support like Alcoholics Anonymous, that's been around a long time, but
Yep.
also professional behavioral health care, a coach, counselor, or therapist, and also safe, effective, FDA approved medications. The great news is that most, if not all, of those options are compatible and combinable rather than competitive. And then
Mhm.
one last notion we're trying to get beyond is that recovery means only lifelong abstinence. Sobriety is a great goal, and the research tends to show that the safest level of alcohol use for any of us would be zero. But if we insist on abstinence as the only legitimate goal, that
Yeah,
serves as a disincentive for some people to seek treatment at all and is
sure.
therefore self defeating. And so we embrace a broader definition of recovery that includes sobriety and moderation within safe drinking guidelines.
Interesting. So my personal experience is my dad was an alcoholic. So I remember as a little girl going to taught and Alateen classes, and he was in programs where he literally was hospitalized for a period of time to go through that detoxification process, and really just was never successful. It was something that he struggled with his whole life. So you talk about this medication. Is that new? How long has that been on the market?
First, appreciate your sharing that. What I'm sure was a painful chapter.
Oh, absolutely. My
It
parents divorced. I mean, it changed everything in our life. Yeah.
Yeah, it is remarkable. And one of the things I've learned from this journey of building our health is that most of us have seen the impact of alcohol on at least somebody we
Mhm.
care about. And, obviously you had a particularly acute case of that. The answer to your question is that safe, effective, FDA approved medications to treat alcohol use disorder are not new.
Mhm.
Um, Naltrexone, which is the recommended frontline medication for people with moderate to severe alcohol use disorder, received its FDA indication for the treatment of alcohol problems in 1994. So that's about 30 years ago. And the real problem here is not an absence of effective tools, it's a lack of awareness and utilization.
Yeah, because if you think about it, I mean, we are in a culture of whatever condition I have, let me just take a pill for it, and that will help me, right? It's usually a much easier or go-to alternative compared to maybe more permanent lifestyle changes. And I can't imagine if that was available for my dad, how that might have changed things. So I'm shocked to know that it's been around since 1994.
It is pretty shocking. And I think you hit on an irony that a lot of your listeners will recognize, which is those of us in the healthcare industry are often accused of over medicalizing, so turning any behavior slightly outside the mainstream into a condition, and over prescribing, throwing a pill at everything. The
Yeah.
treatment of addiction and alcohol use disorder is kind of a glaring exception to those generalities. To just dimensionalize the treatment gap here, there
Mm,
are about 29.5 million Americans who meet the diagnostic criteria for alcohol use disorder. About
mhm.
2% of them are prescribed a medication to help them drink less or quit. And so one of the questions I'm asked the most is, why? What accounts for this gap? And
Yeah.
there's plenty of blame to go around, but I would highlight three things.
Yeah.
One is the drugs are generic and have been since before direct to consumer advertising of pharmaceuticals really became a thing. So there's no
Mhm.
pharma company that has the incentive to make naltrexone a household name
Mm,
like
mhm.
Viagra or Prozac. Number two, healthcare professionals still don't get enough training in the treatment of addiction, and so may not feel confident and comfortable using their prescription pad in a primary care setting, in an emergency department, to help someone get started drinking less or quitting. And then lastly, there is still a little bit of a stigma and a resistance to the use of medication in some traditional treatment settings. You still
Mhm.
hear things like, don't replace one drug with another, which doesn't make a lot of sense to me as a criticism of something like naltrexone that's not addictive, not subject to abuse.
Right. Yeah. Yeah. Fascinating. So I kind of want to shift the conversation a little bit around the commercialization journey, because that's a big part of the conversation here is, our audience are innovators and disruptors like yourself that are really trying to transform healthcare. And, that commercialization journey is very challenging. And so, this is an opportunity for us to share some of those successes and some of those challenges so we can learn from one another. So far, what has been your number one commercialization strategy that you've seen to be successful for you?
Increasing access through convenience and privacy. When I first kind of started to think about the question of whether my experience with naltrexone that was so transformative
Hmm.
could be the basis for a business. One of the things that I worried the most about was, hey, this is a generic drug. I can't patent this particular intervention.
Yep.
But what we've found, because the gap from research to practice and to dissemination of the leading clinical guidelines on how alcohol use disorder should be treated are so broad, there was actually plenty of room
Hmm.
to get people the treatment that they needed and the guidelines said they should be getting, and to build a business by
Yeah.
focusing very almost maniacally on how can we make access to this safe, effective medication as approachable approachable as possible, and specifically making it convenient and private, because that's what people told us they wanted when it came to getting access. Those things are easy to say, but have required a cycle of iterative product development to, for example, get our initial onboarding down from 30 or 40 questions to four that help someone figure out whether they might be a good candidate for this medication.
Mm-hmm. Okay. So when did you start the company?
We served our first patient in January of 2021, so we're going on 3 years.
Yeah. Okay. So just share a little bit about that journey, because 2021, there's a little bit going on in 2021.
Totally. We are very much a company that was built during the pandemic. In terms of service delivery, it wasn't the worst time in the world to build a telehealth business focused on addiction. And I mean that in two ways. One is we know that alcohol use increased
Uh-huh.
during the pandemic, and
Yep.
some of that alcohol use translated to alcohol misuse and alcohol use disorder. Not surprising when you think about what the effects of stress and disruption are to substance misuse.
Mm-hmm.
Secondly, we saw about 30 years of telehealth adoption happen in about 3 years. And
Yeah.
so folks got a lot more comfortable receiving medical care over the internet. So it kind of was a good time for our business. Now we are need to figure out what our post pandemic
Sure.
operating model is, and the challenges there are less so in the delivery model, which still really continues to work for our members, and more so how do we bring together these people we hired remotely all over the country into one organization. What's the role of working together in person in
Mm.
that? We've still got some things to figure out on that front.
Yeah, yeah. That's interesting. A lot of challenges that business owners and leaders are kind of trying to figure out. How do we go to that next phase of leadership or business or culture in this more hybrid model? For sure. One of the things that's kind of ironic about my business is I started Legacy DNA as a virtual company 13 years ago. So
Wow.
before, way before the pandemic. So we were kind of prepared more than most organizations. And I know a lot of people have tried to revert back to, the way we functioned prior to the pandemic. But I encourage everyone to kind of like reimagine how you can work in a distributed remote workforce and being able to lead. It takes a lot of different tools and skill sets to do that, but there's definitely a way to be able to do that effectively.
Well, give me some advice. What do you think are some of the keys to helping a distributed team kind of come together?
Yeah. Um, so you know how, and this is probably obvious, but I think it's overlooked, is that, we're very much accustomed to that water cooler time, right? Bumping into each other, walking into someone's office. And for me personally, I'm a very task oriented person. So I remember in the beginning when I would start to have team calls about projects, I really want to just jump right into the task at hand, get it done and move on because we've got work to do. But I learned over time that I needed to create space, even in those work calls, to be able to have the team members be able to kind of have a little bit of that water cooler time and build rapport, because we were going to be a lot more effective after in our conversation if they were able to have that relationship water cooler time first. If I tried to remove that or force that out, you just didn't get the same productivity or creativity out. The other thing is a lot of virtual team building activities that are like built in like monthly or quarterly or annually. And then certainly if you can, an annual or even every other year. It really depends on how many employees you have and how far and wide they are, on how often you might bring them together face to face. But we have tons of clients and team members that I've never met in person,
Wow.
and it's worked.
I appreciate that. That leaving space for getting to know each other as people, not just as colleagues, hits
Yeah,
home for me. And as kind of a fellow task and performance oriented leader, probably something I could leave more time for, create more time for. So
yeah.
thank you for the actionable tip.
Right. Yeah. I mean, I think if you asked our team, that they have probably feel just as connected to their colleagues as anyone else would be in a face-to-face environment. And also part of that activity is facilitating some of that vulnerability and transparency as well, so that they're able to have forge those deep connections, and it not just be conversations around projects or deliverables, but they're really kind of getting to know each other and build that relationship on a real deeper personal level too. Yeah.
Yeah, that makes sense.
Cool. Um, so I when I have guests on the show and we're talking about this commercialization journey, I want other people in the audience to kind of be able to think that they're not the only ones that are struggling. So, what's one of the hardest things, challenges that you've encountered in being able to build this business over the last few years? Maybe one of your favorite failures.
um, as said at the start, the fundamental challenge that our business faces and that the effective treatment of alcohol use disorder faces is increasing awareness of this treatment option.
Yeah.
And I think the biggest challenge that we've had is finding those right channels to reach the folks who could most benefit in the moment where the message is relevant and actionable. And in some ways, we had the good luck and the misfortune of having a lot of success in our first marketing and customer acquisition channel, which was Google Ads.
Mm-hmm.
And as you probably know, search is a very high intent, lower funnel channel. And
Yep. Yep.
so even the first kind of amateurish ads that I wrote started to help us find our people.
Yep.
And we were able to build a small but real business on that one channel. The challenge that that's created is we probably got a late start on diversifying our channel mix. We've started to have some really good luck on the radio, which is an old-fashioned channel, but one
Not as
that
competitive, right?
yeah, exactly. Not a bad thing. That it's sometimes overlooked, and are encouraged that unlike with search where people have an intent of some sort that brings them to Google, we're able to reach people on their way to work, on their way home, and tap into maybe a latent concern or desire for change and activate that. But ultimately, to kind of achieve our mission of helping everybody who wants to drink less or quit get access to the safe, effective tools, we need to find a lot more channels.
Yeah.
And the message, the medium, the call to action may differ significantly across those. So we have a lot more muscle to build in that regard.
And it's an iterative process, right? You learn and optimize and learn and optimize really for the life of the company. I know that's kind of sometimes frustrating, because we want it to be okay. These are the channels, these are the messages, and we're done. Let's just put the money in and watch the money come out. But it is always an iterative process, especially with all the changes that happen across these platforms.
I couldn't agree more. I think every time that we've kind of siloed ourselves as a team and said, okay, we've figured out what this feature should look like, we've gone wrong. Every time we've talked to customers and asked them about their journeys, the problems they're trying to solve, their reactions to very early, sketches of product concepts, they've led us in the right direction. And so I've become a big believer in iteration guided by getting feedback from customers or the people who you think should be your customers as early as possible. If you're not slightly embarrassed by the maturity of the iteration you're showing them, you're probably waiting too long to
Oh my,
get their feedback.
I love that. I love that. And I did not pay him to say that, people. This is like one of my soapboxes. It blows my mind on how many companies ignore customer feedback or just look for validation of what they already believe and think that they don't have time, don't have money for it. And I'm thinking, oh, you're going to learn the hard way in the long run. Ask everyone as often as you possibly can, because that's how you're going to get better. That's how you're going to get to product market fit faster. It's the secret. Yeah. Cool.
Totally. We're one of our kind of, major product questions, as you can imagine, as a company that started with increasing access to medication, is what other elements of the recovery toolkit should we be providing directly rather than, referring folks to other resources that are out there.
Yeah. Yeah.
And, we've got some hypotheses based on how important simplicity, approachability, and something rooted in evidence are to our existing customer base. But have found that rather than investing 3 months building an app, what we're finding much more luck with is simple versions of guidance on what people can do in their lives to drink less or quit, and running 2-week tests on those, even if it's just through email and a simple web page rather than something we sink a ton of engineering resources into.
Absolutely. I mean, it sounds like you're on the right track, right? Having those hypotheses, testing them, doing all of the iteration. Um, so that way you're investing your money more wisely. Yeah. So, Jonathan, I want to ask you, are there any authors or books, maybe 1 to 3, that have really been impactful for you personally or in your business, when you think about being able to grow either spheres of your life?
Yeah, absolutely. So first is a book called Winning on Purpose by some of my former colleagues at Bain and Company. That's a great guide for anyone who's building a mission-oriented business in terms of how you can use that sense of purpose both to connect with consumers and to inspire and guide the team. Secondly, and more specific to the problem that we're trying to solve, would recommend to anyone who's evaluating the role of alcohol in their life a book called The Miracle Method.
Mm,
which is kind of a funny title because there are no miracles here.
yeah,
But what is insightful about it is that it has a host of ways in to drinking less that may strike one as indirect or counterintuitive. So, for example, spending an hour intentionally doing something that doesn't revolve around alcohol and starting with that sort of small step rather than some dramatic intervention at rock bottom that maybe are stereotypical but not
yeah,
particularly accurate view of how change happens. And then finally, on that note of small wins building momentum towards transformational change, have found Atomic Habits to be. It's a probably not the first time this has been recommended on your show, but
yeah,
that's
yeah.
because it works
It,
both in terms of personal change and I think in terms of how companies
mhm.
create big change, big accomplish big projects. It usually starts with some small wins in the right direction.
So, let's kind of unpack that a little bit. As an entrepreneur, to me, it's all about being able to evaluate risk and measure assess what risks are worth taking and what risks you shouldn't. And I think it also affects a lot of the mindset and the habits that leader has that determines how actions are prioritized. So maybe what are some of those atomic habits, teeny little things that you've done that have maybe had some incremental or big impact over time?
I think probably the most important has been building a discipline of testing for the purposes of
Mm,
optimization.
yeah,
So core to our company's operations and mission is kind of making that pathway from learning about alcohol use disorder to learning about medication assisted treatment to consulting with a physician or nurse practitioner to taking the first pill as simple as possible. And there are it sounds simple, but there are probably 100 um, failure points or potential detours in that journey. And so I think one of the small things we've done well from the beginning is saying at any given point we should have live tests in the market at several of those key points and learn from customers in a more quantitative way what is and isn't helpful. And at the beginning, it can feel like maybe a distraction to be setting those up because you have grand visions of, oh, I want to build this vertical and this additional product
yeah.
so that we have a suite. But being disciplined about optimizing the thing that people are doing today can yield some pretty enormous benefits too.
I think it's that oxymoron saying of like slow down to go fast, right? It's kind of painful to slow down and do those things because we just want to make the decision and implement it and go full force. But there's a lot of value to slowing down so that way you can go fast.
I
Um,
think that is probably what I've found to be the biggest challenge, or to look at it a different way, the biggest growth opportunity as an entrepreneur
mm,
relative to my prior roles in much larger companies is needing to get comfortable with a big bold vision and a maniacal attention to the nuts and bolts and knowing in which
mhm,
context, yeah, in which context you are at any given moment.
yeah.
But it's definitely been one of the ways I feel like I've grown through this journey is getting better at both of those and just more comfortable with both of those.
You mentioned Bain. It sounded like you worked there previously. How has that influenced your leadership and entrepreneurship journey, having that kind of background?
Yeah, so working at Bain and Company is terrific preparation to be an entrepreneur. I think maybe more founders and CEOs per capita than any other company in the world among the alumni. I think the fundamental things I took from Bain are maybe threefold. One is structured, hypothesis driven thinking. So you're trying to solve a problem, you have limited time and resources. how do you organize your analysis to solve the problem. It's by writing down a hypothesis as to what you think is the case, decomposing it into the things you either need to prove or disprove to validate or invalidate the hypothesis, and then
Yep.
directing every piece of work towards those. That's really useful in the world of scarce resources that all entrepreneurs
Mhm.
live within. The second is a maniacal focus on consumers. Bain invented the Net Promoter Score, and that is an entry point to really deeply trying to understand what consumers want, what makes them loyal or disloyal to your company.
Mm.
And then finally is just the commitment to getting the job done. One of the things that people at Bain and a lot of other consulting companies have is just an absolute unshakable commitment to doing right by our true north at Bain, which was doing right by our clients, our people, and our communities. And if that meant working till 4 in the morning, that's what it took. I think that same sense that like the right goal is worth doing whatever it takes
Mhm.
is something you kind of need as an entrepreneur too.
Yeah, definitely. So you kind of hint on this as we kind of start to wrap up here. I've found with the guests that I've interviewed, the clients that we've worked with, there's often a desire for both money. I mean, we don't have to act like we don't want to build billion-dollar businesses, but then there's also this real meaning or legacy piece to it. So balancing the money and the meaning. And I talk a lot about legacy. It's part of our company name. So I like to ask our guests, how do you want to be remembered? What kind of legacy do you want to leave behind? And how does that fit into the work that you're doing at OarHealth?
Yeah, my high school principal used to encourage us to do well by doing good. And I think that is a motivation that a lot of us who work in healthcare share. And one of the reasons I've spent my whole career in healthcare.
Mm-hmm.
I hope that the legacy of what we're building at OarHealth is that millions of people, as we know, there are millions and millions struggling with addiction, that millions of people have better access to the full range of evidence based treatment options that can help them take back control over their lives. We have focused so far on increasing access to medication, which is just one item on that menu, a particularly underutilized one. But I hope we're part of a broader movement that opens people's eyes to the reality that recovery is possible, that there are more and more varied options for help along the way, and that you can get started with those privately, conveniently, whenever the moment is right.
Well, I have to think about Thanksgiving and Christmas, right? And the additional layers of family dynamics that are usually happening during the holidays and alcohol consumption and how that mixes in and how holidays might be a little bit different with solutions like yours at their fingertips.
Totally. There's a lot to look forward to over the holidays, but we also know that they can be very challenging times in terms of drinking,
Yeah.
and complex family dynamics can bring up all sorts of emotions.
Uh-huh.
I see you raising your hand. I could raise mine too.
Yeah, yeah,
And even among the most supportive family, there
yeah.
may be traditions and habits that
Mhm.
are hard to break. So we have some great resources on our site specifically about setting boundaries with family and sticking to goals
Mhm.
through Thanksgiving, Christmas, and other holidays. Generally, the best tips are to be honest, to when you feel comfortable, tell your family members that you're making an effort to drink less or to quit and that you could use their help, to start new traditions that don't revolve around alcohol, and then to reach out to the supports in your life. I hope we can be that at OarHealth, but I think many people also have friends, family, people in their community who they can reach out to when they need a little bit of support to get through a tough time.
Absolutely. That's fantastic. So how can folks get a hold of you after the show if anybody listening here wants to tap into those resources or, maybe explore ways of collaborating with you?
Sure. So the best place to start is oarhealth.com. That's OAR health.com. On the Our Story page, people can schedule 15 minutes to chat with me, just as we've been talking, and also encourage folks to connect on LinkedIn. I'm at J. Hunt-Glassman.
Awesome. Well, thank you so much for joining me today and sharing your journey.
Thank you. A lot of fun.
Thank you so much for listening. See you on the next episode of Health Innovators.